Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes. You know, pharmacists play a very important role in patient care, particularly when you're talking about heart failure or patients who are having anticoagulation therapy. Pharmacists can really help patients understand their medications, avoid complications, even improve outcomes. So how does that work, and how can you get involved with that? We're talking with Doctor of Pharmacy from Valley Health, Katie Mloud, today. Thanks so much for joining us and talking about this. Let's talk about patients living with heart failure. What are some of the key ways that you as a pharmacist can kind of help them navigate that health condition and the medications that come along with it?
Yeah, so chronic conditions like heart failure often have complex medication regimens that may be hard to manage. We help in several different ways. One way is making sure the patient gets the medication. You know, if they can't get the medication, then they're not being treated. There's different barriers that we will help them get through, such as cost. A lot of the ones that are indicated are very expensive. If you work with your Valley Health provider here and our Valley Health pharmacy, we have options like 340B pricing. On the clinic side, we help in a way that we do in-depth medication reviews for patients, and we're able to identify interactions or duplications of therapy. And this is very important whenever our patients may have a hospitalization, they're discharged, meds are added or changed, and we're able to identify those issues and address them pretty quickly.
Yeah, it seems like as we all grow and age, things change, and then sometimes things just don't work together. So you help to catch those things.
Yeah, specifically with drug dosing as well. A lot of these medications require adjustment in dosing. They're cleared by the kidney or the liver. And if you have any type of kidney failure or liver cirrhosis, then we're able to recommend dosing adjustments for those conditions.
Okay. And you mentioned also helping with the cost. That's a huge benefit. I know Valley Health has sliding discounts, sliding fee discounts, and things like that. So you just really need to ask. If you're struggling, you need to let people know that you need some help.
Absolutely. And your provider may not be aware of your medications being too expensive or not know your insurance coverage. So that's where a pharmacist really comes into play. We're really good with making sure the patient can get their medication.
Yeah, and that's so important because, like you said, if you can't get it, you can't be optimally healthy as well. Let's talk about anticoagulation therapy. A lot of different medicines for that. How can you help patients manage that?
So this is a class of medications that requires very frequent monitoring and careful monitoring. Clotting is very useful in situations of stopping bleeding with an injury, but sometimes that can happen in a situation the wrong time or place and lead to a stroke, heart attack. So pharmacists help by making sure the dosing is correct. One that probably comes to mind is Warfarin. It's an anticoagulant that has a lot of drug interactions, not only with other medications, but also with food. So a slight change in your diet could affect the dosing of your warfarin. And pharmacists do a really good job of helping monitor that.
What are some of the foods people should be aware of if their warfarin is the drug that they are on?
Well, we generally say it's foods high in vitamin K, and one way to identify that are foods that are green, leafy vegetables. Those tend to have higher amounts of vitamin K. Other foods do though as well. So if you're not sure, it's really good just to talk to your pharmacist and get a better idea.
Make sure what you're eating is not impacting your health. Yeah, that is for sure. Now, you're part of a team. Let's talk about how pharmacists can work with other providers to try to get people as healthy as they need to be.
Yeah, pharmacists are well versed in clinical guidelines. We're able to identify side effects, and we also work very closely with your providers, so we're able to communicate those.
How would you start your conversation with your pharmacist? I know people kind of, everybody's in a hurry picking up their medicines. They may not feel like you have time to talk with them.
Well, we will ask you every time you come to the counter if you have a question. We try to make it as inviting as possible, but do not be afraid to come to the counter and ask for the pharmacist. You can call the clinic and ask for the pharmacist. We're willing to help in multiple ways. We're very accessible.
Okay, just got to be brave enough to ask, right? Brave enough to ask and you'll find the answers. What are your final thoughts on someone who has heart failure and is on anticoagulation medication? What's your advice?
As a pharmacist, we're a great resource, so just don't be afraid to ask us questions. We can help in many different ways.
Yeah, be brave enough to ask. Like I said, you'll get an answer. All right, thank you so much, Dr. Mloud. I sure appreciate your time.
Thank you.
Thanks for checking in on Monday Health Minutes.